Hi, welcome to the Destin Business Forum, brought to you by the Destin Area Chamber of Commerce. I'm your host, Amy Perry, and our guest today is Dr. Nitin Bawa with Bawa Associates. Welcome to the show.
Thank you.
I know the last time you were here, you had 2 locations, and I was joking with you that you had cloned yourself and were able to open a 3rd location in Fort Walton. Is that right?
Right.
Where is that office?
It's on Mar Walt Drive,
Okay.
so where all the other clinics and where the hospital is at.
Yeah.
So it's right there.
And you have, there's more than one provider, right?
There's 3 of us now.
Okay.
So
Dr. Bawa, Dr. Bawa, and Dr. Bawa.
No. So it's all the other associates. So there's 3 of us, and we're all, I've trained everybody in all the different things that we do with the hormones. With things like lasers, I do those.
Okay.
But with hormones, weight loss, you need follow-up, so we have providers who can do that.
Great.
A lot of people want to come to a woman as well, so for the women's health exam and stuff like that. So we do a lot of stuff with women's health care, so we do have female providers.
I have a lot of questions to ask you, but just to kind of review, you have offices in Santa Rosa Beach and Destin and now Fort Walton.
Right.
Okay, now I get to the interesting questions. Hormones and weight loss. I'm not saying that I need either one, but no, tell me the relationship between hormones and how they affect weight loss or someone's ability to lose weight.
Right. We're finding that a lot of people have problems with weight, partly because of hormones. Of course, diet and exercise have a big role to play. But if your hormones are working against you, it becomes really difficult to lose weight.
Yeah.
A lot of women develop hormonal abnormalities, even starting as early as 35.
Wow.
A lot of women develop what is called estrogen dominance, where there's too much estrogen in relation to progesterone, and that makes it difficult to lose weight. Estrogen makes fat cells, uterine cells, breast cells divide, and progesterone keeps that from happening. So women stop making enough progesterone, so the estrogen is more dominant between the two, and that causes weight gain.
So could somebody, let's talk about a woman now, could a woman be doing all the right things, eating right, exercising, and still gaining weight or not able to lose weight?
Exactly,
Because
we see a lot of that, and that is where the hormones play, and even thyroid is important. Most physicians only do 1 test for the thyroid. We do about 4 different tests for the thyroid. For hormone testing, saliva tests are better. So in saliva, only the active hormone comes out, so we get a better measure of what's actually working. So we're able to do a better test for hormones. Even for men, low testosterone, men tend to become couch potatoes, tend not to want to do anything.
That's the reason. It's hormones.
Right.
Well, it sounds like hormones can affect just everything,
Exactly,
really.
yeah. And
Your energy, weight loss. Okay, we don't have an hour, so I'm going to have to skip on to different things. We talked about weight loss. Do you have, and hormones, are there other weight loss methods, weight loss things that you have in the clinic?
We use a lot of different things. There's, of course, the medications. There's things like HCG that is used for weight loss. There's MIC injections that are used for weight loss. We also now have cool sculpting, which is basically a machine that freezes fat. And so it kills off fat cells in focal areas. We have a lot of people who are runners and running marathons, but still have a love handle they can't get rid of. And oftentimes people don't want to do surgery, so this is a non-invasive method. And the way it works is, it was found a long time ago that even kids, when they sucked on a popsicle, they would get dimpling on the inner side of their cheek. And they found out that it was because the cold was killing off the fat cells. And so we know that the cold will not kill the skin, but will kill the fat underneath the skin.
Oh, wow.
And so they use that to come up with this device. So we have that as well.
Okay, a couple questions about cool sculpting. Is it painful?
It freezes the fat, and so you feel a little bit of cold sensation for a couple of weeks after you've had it done. It's a little bit sensitive. It's kind of a little bit numb. I have a 5-year-old. After I got it done, he would come and hit me, and you'd hurt a little bit more than you normally do, but otherwise it's not that bad.
And how quickly do you see the results? You mentioned a couple weeks.
It takes a good 2 months to see the full results, because the fat cells Once they've been injured, they go into what's called apoptosis, where the programmed cell death begins, but it takes several weeks for that to happen, and then it takes a while for the fat cells to get reabsorbed, the body to readjust and shrink in. So it takes a good 2 months to see the full results.
All right. So not too painful, a couple months, and you avoid surgery. Sounds good to me. Lasers. Tell me about lasers.
Yep. And so we have several different laser procedures. This time of the year, sunspots, everybody with being in the sun wants to get rid of sunspots. So we have a treatment called Limelight that helps to get rid of sunspots. This is a picture of somebody who had a lot of sunspots, and with the Limelight, they're pretty much all gone. And there was no downtime, there was no peeling skin. Basically, the dark spots turn a little bit darker right after treatment, and then 2 weeks later they flake off. So it's not like your whole skin sloughs off or anything.
So same questions, I'm sorry to interrupt, but same questions. Is it painful, and any downtime?
There's Limelight is you feel a little pinch of energy. You feel just a little pinch, and it's not too bad. There's no downtime. You don't have to be there's no peeling skin, but we do recommend that people be out of the sun for 2 weeks. So this is a good
Sure,
time
if you're trying to get rid of sunspots, that makes sense. Okay, what other? I know you have several lasers. What other?
For people who have really bad skin, this is a lady who had really deep lines and wrinkles. This is a more invasive treatment called Pearl. This one actually does have downtime where there's peeling skin, but you can see the skin is a lot better. The quality of skin is improved.
It looks like the creases aren't as deep.
And the skin is better looking as well.
Sure.
And this was only a few weeks after, so there's a little bit of redness, but that goes away with time as well.
A little bit more painful, a little bit of downtime, but it seems like it's for more severely.
Exactly, people who have really aged skin or sun-damaged skin.
And then I know you've got some vein removal that you were showing me before the show, and that's just amazing.
And a lot of people with sun exposure, with age, will get red veins on the nose. You can have blue veins on the legs. So the same laser is used for that. It pretty much instantly closes down the blood vessels. So the vein disappears. We have videos online showing, before and immediately after, and you can see it completely gone.
I would imagine this wouldn't be as painful?
We have a laser that cools as it goes along,
Okay.
so you don't really feel it. We don't even have to put on a numbing cream. Sometimes we do that, but for the most part, people don't even need that because it keeps cooling as it goes along.
Doesn't look like there's a lot of downtime. I know I'm almost out of time. What is one more thing that you can tell us about that just blow us away? I know we're going to have some slides on while we're talking on the show, but tell me.
Well, the one thing we're really about is optimizing health. So, too many physician practices are about eliminating disease, but people don't want to get the fatigue better, get people looking better. So we're all about optimizing health, getting the hormones adjusted, helping people lose weight, and then even helping people look better. So it's all about optimizing your health.
Optimize health, feel better, and look better.
Exactly.
Sounds good. Well, come back and see us with your fourth look. No, I'm joking. I'm joking. Tell your wife I'm joking. We'll be back.